Hey docs, it's Latif and Bali here again with another of the video series. So in this video, we're going to be talking about how to structure your virtual consultations or how to conduct your virtual consultations. Now, why is this important? Now, consultation case acceptance is an extremely valuable skills for dentists and associates, and with virtual consultations, a lot of dentists do not quite feel comfortable with it because they are not used to it. But it kind of follows similar frameworks. The only difference is that it's a little bit harder generally to connect or build rapport with somebody that is online versus somebody that is in clinic with you face to face. Now, why virtual consultations? I generally, particularly see it amongst other people as it's the way of the future. A lot of organizations, businesses are realizing that they don't need so much office space. They don't need their workers, the staff, to come to the offices generally, and so there's going to be a rise in management disciplines that aims at improving productivity the remote way. But that aside, now let's talk about dental practices. Now we're seeing a huge uptake in appointment scheduling rates for our virtual consultations, and that's because the patients love it. They don't feel pressured. They can have it at the convenience of their homes, and they don't feel pressured the way they feel if they come into the clinic with the inconvenience that goes along with it in terms of either maybe it's arranging childcare or taking time off work, looking for parking, get onto public transport or driving whichever way. It's so easy. So generally, appointment show-up rates is a lot higher and scheduling rates is a lot higher. On the flip side, and of course, the patients also have that assurance that they are not coming into the clinic. A lot of people are averse to going to the hospitals right now, in the clinics. Now, on the flip side, for you guys as dentists, you also don't want to spend too much money on PPE. Number two, you also, of course, you also want to limit the risks. So that's one side to it. Number two is that the way of the future is that you also will need to pre-qualify prospects, patients before they come in. You don't want to be wasting time with bringing in people that are not going to buy into the clinic. So virtual consultations is also a great way for you to be able to sieve out the buyers from the non-buyers and either book them in for a future appointment or book them in straight away. But I see it as coming to stay is a key component of our service offerings value stack because it just works. It works like charm. So I urge you guys to embrace it. Now let's dive into how to run it. All right. So the first step is the psychology framework. All right. So the key thing is having the headspace for that. Every sales meeting, that's what it is, case acceptance, should be approached with a clear head, a clear objectives, and it should be approached with confidence and great communication, which entails both listening and speaking. But the key thing is that to understand is that the non-verbal skills are more important or more prevalent than the verbal skills. So no matter what you say, if the non-verbal skills do not agree with the verbal skills, it won't look good. And the key thing is to be able to establish a rapport, build a connection with the patient straight away. The next set of things here is the setup and the presentation. Of course, extremely important. You want to come into the consultation with good energy, good vibe. Okay. Number two, you need to dress well, like a dentist. Which is cool. And of course, there are some certain colors that are good for the screen, and there are some certain colors that are not so good for the cameras. Those kind of things, and patterns at the same time. So kind of plain, you can do stripy, but not too stripy, you know. So that's that. The room and the background should be okay without having distractions in the background. It's kind of better if you can do it in your clinic, which looks more professional, but if not, you know, if you've got a decent space, it's better. In your home, but clinic is usually better. Then of course, listening is active listening, asking the right questions is very important before you talk. Now, once the consultation is over, but of course, I talked about listening. Before you listen, of course, you're asking some connections to understand their desires, their pains, and why they want this, okay, or what they want to improve about their smile. And of course, you listen well before you come up with your solutions, recommendations, and of course, in addition to that is your value proposition. But so now is the time for you to drop your price, okay? But you just don't want to drop your price straight away without eliminating all non-financial objections. So the way to do that is to ask, which we call the bridging questions, is to ask some kind of questions like, is there, okay, I understand your needs, this, you know, explain the treatment and the solution in simple terms and ask, but apart from financial issues, financial consideration, is there anything that will prevent you from going away, from going further with the treatment? And this gives you every opportunity to address all the objections in relating to the treatment. So of course, every type of treatment, Invisalign, dental implants, smile makeovers, will all have their own set of objections. You should know all of those for all of those treatments. So you want to address all of those objections, then you drop the price. And of course, when you drop the price, just keep quiet and wait for them to make a decision. But it's also key to provide clear pricing options. Okay, now, so this is so clear pricing options, number one. So the other, I've lost my trail of thought, but the key thing to say here is, apart from clear pricing, you've eliminated the objections. So I'm back. You've eliminated the objections. You've eliminated the non-financial objections. So at this stage, if it is financial, the question is, how can you help them as a clinic to help them financially? And by that I don't mean you giving them money, but it's all about providing financing options that they can access to ease the burden of the treatment. So that's it. And of course, the key clear path to the outcome of what you want to achieve is either to collect a deposit for a future treatment, which is preferable, or to schedule in people for future in-clinic appointments. But I have to stress that it's more than important. It's extremely important that you should collect deposits for your appointments. It's also a way to pre-qualify people, the serious buyers, right? And also prevent no-shows. So that is it. And follow this framework and become a rock star at virtual consultations. Thank you.